Muscle Delta Therapy Assistant, Geriatric Patient Case Study. Patient Summary. 78-year-old male, brain cancer surgery, right side immobility, resulting in trip and fall events. The surgery resulted in right side immobility from muscular shortening, muscular weakness and muscular nerve damage. Each one of these ailments are effectively addressed by this treatment. Prior to treatment, the post-surgical muscular ailments resulted in several trip and fall events. The Muscle Delta Therapy Assistant is non-invasive, safe, gentle, and proven. Only pressure is used to lengthen very specific muscles. The pressure is determined by the patient's comfort and safety. Managing patient treatment plans is easy. Predefined templates for specific therapy protocols for instant patient setup. Modify and assign a template to a patient for ongoing use. This makes it simple for any PT to implement doctor and corporate defined treatment plans. The Muscle Delta Therapy Assistant Quick Reference Database shows muscles, nerves, and arteries, and describes connection points and actions. We have determined that educating patients allows them to understand treatment and makes treatment even more comfortable. Range of motion is evaluated with Muscle Delta proprietary touchless software. No touching the patient or writing is necessary. The patient is shown a video of the motion to demonstrate. A 3-second video is captured. A report is generated and auto-distributed to stakeholders. A treatment plan is designed or selected from a predefined plan. This establishes a baseline to ensure measurable results. Treatment for these muscles was prescribed. Psoas, subscapula, pec minor, serratus, quad, TFL, scalenes, and SCM. Patient's pre-treatment range of motion results. Right hip flexion 61% less than average. Left hip flexion 27% less than average. Right neck lateral 87% less than average. Both hips cannot lift leg properly, right side severely affected. Neck and shoulder severely limited motion. 1.5 months post-treatment range of motion result. Right hip flexion 20% increase from pre-treatment. Left hip flexion 11% increase from pre-treatment. Right neck lateral 25% increase from pre-treatment. 3 months post-treatment range of motion results. Right hip flexion 32% increase from pre-treatment. Left hip flexion 20% increase from pre-treatment. Right neck lateral 30% increase from pre-treatment.
About a year and a half ago, I was diagnosed with brain cancer, and it was required surgery to cure. The surgery was successful. They got all the cancer out, but I was left with mobility problems. I fell on my face, tripped. Machine applies to a little rod with it has an arm, a lander, and a rod that comes down with a device on the end, and it applies pressure to a very specific location. And the pressure is where the practitioner wants to say, ask me how much I can take. You say if it's too much, you back off. If it's not enough, maybe I can take more. He'll do that. But for the whole treatment, it's very safe. So I don't have to worry about suddenly I'm going to jump out of my seat or jerk, or that it's not enough. The pain, the pressure that I take is like beyond very comfortable, but not uncomfortable either. So it works. There's been no residual black and blue or whatever marks on my body. It's very non-invasive. It's just wonderful.
And about the consistency of the therapy versus a hand that could be.
Oh yeah, I mean it's just more consistent. It's very. Oh, it's a machine that knows. You know, you set the pressure and it's going to beat that pressure. So I don't have to worry about, you know, a practitioner jumping and suddenly pushing a lot harder or not pushing hard enough. So it won't hurt me. Whereas a chiropractor or whatever, a regular chiropractor will say, you know, is this enough pressure? And I may be repeating myself, but I'm comfortable with what you provide. You know, I'm looking forward to the treatment versus dreading it, and I'm not left bruised after the treatment. It's just a friendly kind of environment. Very, very good, very nurturing, and I'm not afraid to come back. I feel that I like the process. I really want to keep doing this because number one, blood flow, and number two, feeling comfortable. There's no real anxiety in terms of pain. And when I leave here, I just I can walk better. So it's nothing. That's it.